Hello, I'm Dr. Natalie Jones, Clinical Academic Occupational Therapist, AHP Lead in Primary Care and an HIR Postdoctoral Research Fellow at the University of Sheffield. So, why are clinical academic AHP posts the missing ingredient in modern healthcare? Although this career path looks linear, the reality has been much messier. I didn't truly step into research until around 2012, and it wasn't until I started a Master's in Clinical Research in 2014 that my trajectory became much more intentional. Earlier in my career, opportunities to engage in research simply weren't there. Progression as an AHP traditionally meant stepping into leadership roles. And while this experience has strengthened me as a researcher, I believe that we, as today's leaders, have a responsibility to support the next generation into research much earlier in their careers. Studying alongside family life brings its unique challenges, and life as a mature student is rewarding but demanding. Sadly, there were no clinical academic roles for me to go to after my PhD, and creating one or working together with partners to see what was possible did not seem an option. When the conditions were no longer right for me to thrive, I chose to take the learning, development and skills I had gained and apply them in a new organisation. And now I have the portfolio career I dreamed of: clinician, teacher, researcher, leader, but in reality, these roles often operate separately rather than synergistically. And I believe there's greater potential if we can better integrate these roles in the future. Are you sitting comfortably? It's time for a story. So once upon a time, a naturally curious clinician had some burning clinical questions that would not leave her alone. Fueled by passion to make a difference, she dedicated her career to research, sticking with her topic for over 13 years with a clear end goal in mind. Along the way, she discovered that success requires buckets of resilience, and a good sense of humour doesn't hurt either. Being a creative and innovative thinker became essential. When the usual paths didn't work, she found new ones. Communication and collaboration, non-negotiable. She learned quickly that a great research journey is not a solo trip. Research is a team sport. Leadership was the unexpected companion, first learning to lead herself, then guiding others, and with lots of training from the NHIR to become a clinical research leader. And yes, while her husband believes she has a fetish for cap and gowns, the real reason she loves to dress up and matriculate is far more altruistic. It's about honouring the journey, representing the profession and making sure research matters. And at the heart of it all, a simple but powerful motivation: to make a real difference to patients and their families, because for clinical academics, research isn't just about papers and presentations, it's about changing people's lives. So in case you were wondering, this is what the life of a clinical academic actually looks like. The journey isn't perfect, and it's definitely not linear, and it's full of twists, sleepless nights, imposter syndrome, and yes, a few cap and gown moments. But what makes it all worthwhile is the why. The patients we want to serve better, the questions that keep us up at night, and the hope that what we discover today might transform care tomorrow. So I'm pinning my colours to the mast. We had a debate earlier about research cultures, and you now know which side of the debate I'm on. Research is often treated like icing on the cake, a nice to have, something extra, maybe even decorative. But I believe it should be the main ingredients, something baked right in to the mix of patient care. Essential, not optional. the thing that brings structure, flavour and real value, because without research we're just guessing the recipe. So many of you know that back in 2017 I co-designed a research impact tool with 12 organisations across Yorkshire Humber, and that tool, Victor, has now evolved into an online platform with over 100 account users and 55 health and care organisations in the UK using Victor to capture research impact. I'm delighted to say its new home is the NHIR ARC Yorkshire Humber, and I'm going to use the Victor domains of impact to share some of my research impacts to date. So first of all, health benefits. The Bistro study brought clear health benefits across multiple areas. Psychosocially, it helped patients build friendships, reduce isolation and restore routine. Physically, it reduced deconditioning, improved eating and drinking abilities, and reduced dependence. It even sparked a trust-wide Ban the Beaker campaign. It also supported more meaningful rehabilitation in homely, normalised settings, and for carers it gave them the hope and the confidence as they began to see real progress. One of the strongest themes was that people no longer felt alone in their stroke recovery journey. So the next domain is service and workforce impacts. Across 3 studies I'd like to share with you today, which I've been involved in, the Bistro study, the Viva study and the CC4H study, I've seen real service and workforce impact. We've started, sustained and scaled breakfast groups across South Yorkshire. Inspired by success stories and open research events, other units across the UK have followed suit. Through social learning, support workers and clinicians in the study developed new skills and teamwork grew across roles. The CC4H project led to 4 new Band 4 roles in the community stroke service and a 150k investment in service redesign. Viva paved the way for remote consultations, reducing clinicians' fears of using telehealth technologies. So the next domain is research profile. Being research active raises your organisation's profile and helps build a culture where evidence is more easily translated into practice. For me, I published 5 peer-reviewed publications on the Viva study, which led to an NHIR evidence alert influencing virtual consultation guidelines. I gained skills through leadership fellowships with the King's Fund, have taken on new leadership roles, and now review for journals, grants and awards, which brings all sorts of opportunities for me and for the organisations I collaborate with. Networks and collaborations have grown too, including a project with 2 Dutch universities, and I'm super proud to be invited to speak at the NHR Stroke Conference on inclusivity in research. Again, recognition not for me but for my organisation, because a strong research profile doesn't just open doors, it puts your service on the map. But research awards, it's not just about trophies and titles, it's about telling the impact stories. Awards shine a light on the work that might otherwise go unseen and give visibility to patient-centred innovation and inspire others to do the same. Recognition boosts confidence, builds credibility and opens new doors for individuals, and not just for the individuals but for the whole team and services, because when we celebrate impact we feel the momentum of it, and when others see what's possible they start to believe that they can do it too. So I believe that award-winning research sends a clear message: we don't just deliver care, we shape it for the future. So research isn't just about generating new knowledge, it's about creating value. Imagine free training for staff, unexpected equipment donations. So the TWIST study funded Nintendo Wii's for the community stroke service, brand new assessment tools and devices. Beyond that, research brings in commercial income and boosts funding for infrastructure, teams and patient care. And the real magic, well, that's the unplanned gains, like the shared skills, reduced training costs, new roles, better efficiencies. High quality care today means fewer system costs tomorrow. Research is an investment, but not just in the ideas, in tangible real-world impact. So research funding isn't just about the numbers either. Here are some of my examples. So, for example, the Primary Care and Occupational Therapy Research Award was instrumental in defining OT's role in primary care and providing evidence-based resources for GPs to enhance patient care. The Viva study shows how research and digital innovation are reshaping healthcare policy, with remote care now a national priority. The Action Research Arm Test was developing a streamlined tool for clinicians, research funding fueling innovation in patient care delivery. Some of you may have heard about the triceps trial. It's been on television quite a few times recently. So charitable funding for the vagus nerve research study started with a proof of concept study, which I was the PI for. And it's now evolved into a multi-site clinical trial. It's actually advancing groundbreaking research in stroke rehabilitation. So from those small acorns, the mighty oaks grow. And finally, the NHR Career Development Awards, which it's been an honour and a privilege to receive. I've funded my career research journey so far, and they're now funding research into post-stroke eating and drinking difficulties, which again is groundbreaking research. Research funding is the lifeblood of driving real change in healthcare, and it builds the evidence, it shapes the policies, and ultimately transforms patient care. So from systematic reviews to large clinical trials, the funding is paving the way for better patient outcomes. So the next domain is organisational influence. So research doesn't just change patient care, it boosts an organisation's ability to influence, and it does that partly through profile building. So take the stroke research in Sheffield, for example. It's not just about breakthroughs, it's about being known for it. It's about being invited to speak at high-profile events, conferences, in this country and abroad. It's about delivering open plenary speeches. It's excellent PR and in credibility building, but ultimately that profile and that influence can lead to recruitment and retention improvements. The impacts don't just stop there. Research builds relationships, opening doors to new collaborations and networks. A raised profile means more investment opportunities, and those collaborations can turn into projects with real-world impact. And let's not forget the workforce and community influences. So the cross-site collaborations within our own ICS. The Bistro study brought together 3 stroke services. Bringing healthcare professionals together is a fantastic way to spread and share good practice. And we know that as AHPs, when we get in a room together and we unite, great things happen. So research isn't just about the profile building either, it's a real catalyst for growth at every level. For the individual clinician, of course, it's a confidence boost, a credibility badge, and sometimes a golden ticket to new exciting opportunities and collaborations. There's definitely that side to it. If you win these awards, they come with fantastic opportunities. For the team, it lifts morale, sparks fresh connections, creates a shared sense of pride, and it's also a magnet for top talent. People want to go and work where their organisation has a good profile and a good reputation. So for the organisation, that strengthening of the reputation is very important. And collaboration with research can strengthen bids as well, because academic partners need NHS partners to strengthen bids. And also it proves commitment to evidence-based care and improves patient outcomes, and as NHS organisations we really want to be at the forefront of that. So in bake-off terms, research turns a good recipe into a showstopper. So research is not just about discovery, it's also about delivering better care, which starts with the generation of new knowledge, like systematic reviews on the psychosocial impacts of eating and drinking difficulties, and a study that proves breakfast group interventions work, are feasible and acceptable. And then comes dissemination, sharing the findings through conference papers, presentations, so the benefits can reach far and wide. Research also sparks collaboration, team swaps, ideas, innovations. And new clinical tools can emerge, like the Bistro Actionable Toolkit. It builds capacity too, as staff are trained in research skills, become champions of evidence-based practice. Patients get involved through co-design, making sure research stays relevant and real. From influencing policy to redesigning services, research drives innovation, and it highlights inequalities and pushes for inclusive care. The impact of that knowledge generation, real change, like the breakfast group becoming standard across South Yorkshire. So knowledge is great, but sharing it, that's when the real magic happens. From opening plenaries in Barcelona, Munich and Italy, this research has frequent flyer miles, peer-reviewed publications and a digital footprint that's hard not to miss. Blogs, vlogs, YouTube, Twitter talks, if it can be posted, it's out there. That's what clinical academics do, they're always sharing their research. Add conference hosting duties, like sharing a topic stream at the European Assistive Technology Conference with speakers from all over the world. Local news, radio, translation of knowledge. What happens when researchers talk about their research is a global ripple effect. So if my junior school teachers could see me now, my school report read, Natalie is always distracted in class. If you see from the picture, I'm not even looking at the photographer. She needs to spend less time chatting and more time focusing. Fast forward many years, and that curious, chatty girl has turned into a passionate person with a relentless drive for innovation. A clinical academic is a mixture of passion, resilience, and a dash of stubbornness to challenge the status quo, because this is not an easy path to tread as an AHP. Clinical academics thrive on managing data like a pro, and they're always pushing for better care, because good enough never is. With a strategic mind, they juggle teaching, research, clinical practice and leadership, all while mentoring the next generation of trailblazers. Being a clinician, a researcher, an educator, a leader means showing up with curiosity, creativity, compassion, and committing to a career that's not just about progression, but about impact. I'm not just here to make the change, I'm here to lead the way. So the take-home messages from today. Why are clinical academic posts the missing ingredient in modern healthcare? Answers on a postcard. There are many reasons. Unclear career pathways, insufficient workforce development in organisations, AHPs still marginalised in research, limited organisational support and infrastructure, lack of protected time, fewer opportunities, cultural barriers, to name a few. The point is, it's not right, and that's our call to action today. You've hopefully got the message. You've seen the value, you've felt the impact, and you've heard how growing and retaining clinical academic AHPs is not just a nice to have, it's an essential ingredient. Clinical academic AHPs should not be the missing ingredient because we bring the innovation, the curiosity and the evidence, and we turn everyday care into exceptional care. We drive and bridge the gap between practice and progress. I've seen many people lose their jobs or leave organisations on their career pathway, which is so sad. Losing our aspirational clinical academics is nothing short of a travesty. Being a clinical academic means wearing many hats, balancing clinical work, research, teaching and leadership. As leaders, we have to think creatively, collaborate boldly, and pioneer new ways of working to keep these people in our clinical services. Because clinical academics aren't just improving their own careers, they're clearing the paths for others to follow. And ultimately, it comes down to this: better care for every patient, every day. So I want to finish off today with Marge's story. So Marge was a participant in my study. She shared her story and we listened. Her lived experience became a powerful teaching moment for us all. We took notice and together we co-designed an intervention that addressed the real needs of stroke survivors with eating and drinking difficulties. Now patients across South Yorkshire are actively participating in breakfast groups, reaping the benefits of research-driven care. This isn't just theory, it's real impact, real world impact that improves lives. And that's why we're all here today, to see how research can make a tangible difference in patient care, because that's what matters most. Thank you for listening.